Good morning from the Oklahoma Insurance Department. My name is Wyatt Stanford, and I work in the Communications Division here at OID. Thank you for joining us for our Medicare Mondays webinar series. For your awareness, I do want to mention that this webinar is being recorded. Before we get started, I wanted to share a little bit about what the Oklahoma Insurance Department, or OID, does. OID is a state agency, and we are responsible for regulating the insurance market and enforcing the insurance-related laws of the state. We have an entire team devoted to protecting consumers by providing them with accurate information and timely assistance. We can also deal with your insurance company if you cannot reach an agreement regarding a claim. If you would like to reach out to us for help or if you have any questions, you can call us toll-free at 1-800-522-0071, and you can also visit our website at oid.ok.gov. For today's webinar, you'll be able to see and hear us. However, we cannot see or hear you. If you have a question, please type it in the chat. At the bottom of your screen, you will see several options, one of those being chat, and if you click on that, you can type your question there. We will say time to answer questions at the end of the webinar. Now, I'd like to introduce our speaker, Ray Walker. Ray is the Divisional Director for the Medicare Assistance Program at the Oklahoma Insurance Department. Mr. Walker has over 20 years of experience working in and around the healthcare industry, primarily in insurance, and has had the privilege of speaking to groups across the state and around the country. Ray, now over to you.
Good morning. Can you hear me okay, Wyatt?
Yes.
All right, good deal. Wyatt and I have had a very interesting morning dealing with sound and video and all sorts of fun things. So good thing that things are now working again. So glad everybody could join us today. Hope everybody had a good weekend. We're getting into that time of year again when we're beginning to get prepared for open enrollment. So we've got a lot of information to convey to you very quickly. So let's go ahead and get started. First, as always, I want to give you information. The Medicare Assistance Program at the Oklahoma Insurance Department is funded by federal grants through the Administration for Community Living. That gives us funding to go out and educate Oklahomans about Medicare and how Medicare works and the different parts of Medicare, as well as how to educate yourself about the problems with Medicare fraud and how to protect yourself from becoming a victim of Medicare fraud. It's a very important issue in our state today. Also, as well as about programs that are available to people who are low income and who might want some assistance in paying for their Medicare prescriptions or their Medicare health plans and things of that nature. So if you have any questions about Medicare, whatever it may be, you can always contact us at the Medicare Assistance Program at 1-800-763-2828, and that information will be available again at the end of our presentation today. But for now, let's go ahead and get started because, as I said, I've got a lot of information and very little time to share it with you. If I go over something too quickly today, don't panic. You can always call us and we would be happy to go over it with you at a much more easy to listen to pace. But this is very important information. People are getting bombarded constantly with data, with information, with commercials, all of this stuff about what's available out there. And as we get closer to October, that's just going to get worse. So I always like to, at about this time of year, like to share information about what is and is not allowed. And I want to give a special thank you to the Centers for Medicare and Medicaid Services, CMS, because I pulled some of the information directly from them because they're the ones that actually set the rules. They're the ones that actually regulate the Medicare Advantage plans, the Part D prescription drug plans, and all of those entities. Frequently, we will get asked by beneficiaries when they've got a problem with their Medicare Advantage plan or their prescription drug plans to step in and to try and regulate those plans. Unfortunately, the Oklahoma Insurance Department does not have regulatory authority over those entities. However, we can assist. We can help walk you through the process of how to file a complaint or something of that nature. So let's go ahead and get started. First, I want to talk a little bit about the materials, the printed stuff, the things that you can read for yourself about these plans. When you're talking about the stuff that comes out from CMS, They reference these materials broadly as communication materials. This is the printed documents that are there to convey information about Medicare Advantage plans, Part D prescription drug plans, etc. And then a subset of those communication materials are called marketing materials. And those are the materials that actually are created to steer you toward a specific Medicare Advantage plan and the benefits of that particular plan. So communication materials are sometimes also referred to as educational. And then there's the subset that's the marketing materials. So as we go through here, the things that we need to keep in mind is CMS does require that they be allowed to review all marketing materials. So anything that goes out from these plans has been reviewed by the Centers for Medicare and Medicaid Services. They also create standardized and model materials that the plans are required to use. They also create model communications materials like provider and pharmacy directories. Now, the plans are required to use the standardized materials, the language, the formats without any modification. They can't change those. So it's something that you want to keep in mind. Now, marketing for the upcoming plan year has to wait. They cannot market for the upcoming plan year until October 1st of each year for the following contract year. Now, something to keep in mind, because we have all seen this, is I'm seeing commercials now. Why am I seeing a commercial for this plan or that plan now? Well, because people are turning 65 all the time. All right. There's always some reason why someone might need to know about that particular Medicare Advantage plan or that drug plan. So technically speaking, they can market to those people who are now becoming eligible for Medicare for whatever reason. However, regarding their offerings for the upcoming year, for 2026 is what we would be talking about now, they cannot market those plans until the beginning October 1st. Now, when they're referencing the plan's star ratings, as you know, these plans have a possibility of a 5-star rating. That's the highest they can have. And when they're referencing those star ratings, they can get a rating in several different categories. But when they're referencing their star ratings, they're not allowed to break it down into one little category, or they may get a 5-star rating in one area or another area, but they're not allowed to just pick and choose which areas that they use in their marketing materials. In other words, if they get a 5-star rating in, we'll say, claims processing, I'm just making something up for the purposes of our conversation, they can't just put that one in there and not mention that maybe they got a lower rating in a different area. They have to use their cumulative 5-star rating when they're doing their marketing. They can't just point out the ones where they did really, really good. The other thing that's very important is you'll notice this kind of upside down red triangle on here. Any plans that have done poorly overall, they also have to make beneficiaries very aware of that concern. And they have to display this emblem and make people aware, we're not doing so hot in this particular area. And that means that they've achieved a 2.5 or lower in any particular area. So it's important to CMS that not only you know which plans are doing very well, but also those that might be struggling in one area or the other. And that's so that those plans who aren't doing as well are incentivized to improve in those areas. Now, disclosure of plan information for new and renewing members. There are certain informations that they are required to get out to all members. The notification of available and electronic materials. Some people prefer to get their information the old-fashioned way in the mail. Some people like to get it electronically. And CMS is willing to provide them either way, and they want the plans to provide them either way, depending on what the beneficiaries want. So, with or without the beneficiary's permission, these plans can make people aware of the fact that they have that option. You can get your stuff electronically, or you can get it in the mail, printed. And so they can notify people, hey, FYI, if you'd like, you can notify us and we'll start sending you stuff electronically instead of sending it to you printed in the mail. And this is how you can request that information. And the types of information that we're talking about here are some things that are pretty big. They can be a pretty large document, takes up a lot of paper and stuff. Things like the evidence of coverage, which is that document that comes out every year that tells you pretty much everything there is to know about a certain plan. The pharmacy directory, the provider directory, those things can be pretty large, and they can be found online pretty easily. And that way you're not taking up a whole lot of paper, save a few trees, et cetera, et cetera. So this is a good way where people can find that information. It's also a lot easier to update. So they can update that information as needed online, and it's more current. Also, documents for new enrollees must be provided no later than 10 calendar days from the confirmation of enrollment or the last day of the month before the effective date, whichever comes later. That's for people that are newly enrolled. Now, the required materials that have to be delivered electronically with the prior consent of the enrollee. Now, if somebody wants them in paper, they can get them in paper. But one of those is the annual notice of change, or the ANOC letter. That's the thing that says this is what's changing about this plan. If there's benefit changes, if there's a premium change, anything like that has to be in that ANOC letter. Now, there's another document, the ANOC and the EOC errata. Errata just simply means what's changed, what might be an error that was in the document that has to be corrected. That's what that's talking about. Also, any enrollment or disenrollment notices. Now let's talk very quickly. We've talked about the printed materials. Let's get into the actual events. When we're talking about an educational events, I spoke earlier about the printed materials, how there's sort of a differentiation between the communication or the education materials versus the marketing materials. The plans or the representatives of those plans can hold an educational event. These educational events have to be advertised as educational. And at those events, what they can do is they can talk about what is a Medicare Advantage plan. They can talk about what Medicare is. They can talk about what a Part D plan is and how those things work. Basically, they're education. So I've seen those events be very, very useful in terms of just telling people what their options are for people who are just getting into the Medicare scene. Now, during that particular education, they can distribute communication materials. They can hand out business cards. They can answer general questions that are initiated by that person who's got Medicare. They can make available and get contact information from individuals, like a person's business card. They cannot conduct any marketing or sales activities. All right. They can't collect scope of appointment forms, and I'll go over what those are in just a moment. And they cannot distribute any marketing materials, anything that's plan specific about this is what our plan is and how much it costs and things of that nature. They also cannot collect any enrollment forms. It has to be strictly an education type event. Now, they can have a sign-in form, but they cannot make you sign the sign-in form. It's got to be optional. Now, after the event, they cannot conduct a marketing or sales event within 12 hours of that educational event in that same general area. So let's say that they've got maybe a room at a hotel or a library or something like that, and they've held this educational event. They have to wait at least 12 hours before they could do a marketing event in the same general location. Now, at a lot of these events in the past, they have given out some pretty good gifts, some freebies that they would have at these events. Some things to keep in mind with these gifts, because they've toned it down quite a bit than what it used to be. For one thing, they can offer these nominal gifts to potential enrollees. It has to be valued at $15 or less. Now there's a rule that says per person they can't get more than $75 per year. I don't know who's keeping track of that. I'm not gonna, but that's the rule. There's $75 or less per year. It has to be given without discrimination. That means they can't say, okay, if you enroll with us, we'll give you this gift, or if you sign uh, our intake or our attendance form, we'll give you one of these gifts. It's got to be given without that discrimination, whether you enroll or not. It also can't be given contingent on the enrollment in their plan. Now, I will tell you that there is a kind of an exception there. There have been cases where they've had like a drawing where they brought in something that's a little higher value, and they've said, okay, we're going to do a drawing for anyone who signs on the attendance form, and we'll do a drawing for this particular item. And that, for some reason, is allowed. Now, whatever this nominal gift is, it cannot be in the form of a cash or of any kind of monetary rebate. It's got to be something, like a pen or something like that. Now, unsolicited enrollee contacts are a no-no. You can't just show up at somebody's doorstep or just walk up to somebody somewhere. This is highly frowned upon. What is allowed would be something like that would be considered unsolicited, would be like if they sent you a card in the mail. That's okay. Everybody has gotten like a flyer or something like that that might have your name on it, but it's going out to a lot of households. A lot of people are getting these postcards that say this is what our product is and what the benefits are. Or emails. There's lots of emails that are going out to people that talk about these products and stuff, or ads that pop up when you're searching on the internet. Now, they do have to have on the emails, there is a place where it says that you can opt out of future emails. So that is one of the requirements for those. Things that are not allowed are going to be door-to-door solicitation. Salesmen can't just show up at your door marketing a Medicare Advantage plan or a Part D drug plan. They also can't just show up in a common area at a hospital or a doctor's office or something of that nature. They also cannot direct social media market to you. In other words, an agent can't send something directly to your specific email address and start a conversation with you, as well as doing any kind of cold calls, like calling your house directly. An insurance agent isn't supposed to be doing that. Although, unfortunately, we have seen a few times where this seems to be happening based on some conversations that we're having with people who have been contacting our office recently. Now, you also can't market non-health related products, things like annuities, life insurance products, and other products when these calls are being made. Now, let's talk about this scope of appointment. What they're talking about when they say the scope of the appointment is when an agent is interested in speaking with you about, let's say, a Medicare Advantage plan, they had to establish ahead of time what is called the scope of the appointment. And that is, ahead of the appointment, they have to say, when we come and talk, we're going to be talking about XYZ Medicare Advantage plan, or this particular Part D drug plan, or maybe they're going to talk about this Medicare Advantage plan and this Medicare Advantage plan and this Part D drug plan. They cannot then add to that possibly a life insurance plan or something like that. Now, how they document this scope of appointment can be in the form of either a recorded phone call or it's got to be a printed document. Now, they are not required to do a scope of appointment in a situation where maybe it's an unscheduled in-person meeting, like perhaps you walked into a insurance agent's office and you started the conversation about these Medicare Advantage products or something like that. In that situation, that's where you've established it. You clearly wanted to have this conversation, so they don't have to do that scope of appointment ahead of time. Now, it is required for most personal marketing appointments, regardless of the location. So if you have called inquiring about this and you're interested in speaking to this, in other words, maybe you saw an advertisement on the television and you wanted to learn more about this product, so you did reach out to find out more about it. At that point, then we are talking about needing a scope of appointment. So approximately 48 hours ahead of that appointment, then you're going to be talking to that agent and they're going to be going through this scope of appointment process where they'll be talking to you about what will be talked about when they actually come and talk to you about this insurance product. So at that point in time, as I said, it would be either the recorded phone call, or they may have you sign something when they show up that is that scope of appointment. Now, recording calls. This is something that started back in 2023, and this is a requirement that all calls that are made between this third-party marketing organization, this can also include agents, brokers, etc., that those calls have to be recorded. The definition includes all organizations, individuals who are compensated to perform leads generating, marketing, sales, and enrollment related functions. If you want to learn more about this, you can just Google agent, broker, marketing, frequently asked questions. This has been quite an adjustment for the industry, but it has been useful because there have been situations where maybe a beneficiary has contacted us and said, well, this person said this. And it's been useful because now those entities have been able to produce a recording to say, well, actually, this is what was said. So it's been useful on both sides. Now, in some situations, it can be somewhat challenging because oftentimes we'll have a beneficiary who has received a phone call, and maybe it is from one of these third-party marketing organizations. It was an outbound call from that entity, and they're paid by the numbers. How many people can you get called and get to respond to these calls and stuff? Oftentimes, the senior that's speaking with them, they don't record the name of the entity. The name of the entity is really very nebulous. It's not very clear who they talk to. And so consequently, they don't have a lot of information for us to follow up on. So it can be very challenging for us to follow up on those things. So my, you know, and the other thing is you can see at the last bullet point here, agents can be licensed in the state of Oklahoma, but not necessarily located here in the state of Oklahoma. So one of the things that I always encourage people to do, if you're talking about something as important as insurance, whether you're talking homeowners, car insurance, or especially your health insurance, I always think it's better if you just talk to a local insurance agent. Find somebody that you can talk to face and have that relationship with, because when you're talking to somebody at some 800 number or somebody that called you, how do you know for sure you're ever going to be able to get that specific person back again? So that's just kind of my opinion. Now, as far as promotional activities, let's talk about these very quickly. Used to, there were a lot of these companies that would provide a meal. That was a great way to get anybody to come in, is they'd furnish a meal and then they'd do their sales pitch and stuff. Well, they can't do that anymore. They can't provide a meal. They can provide what is considered a light snack. And it's got to be something that a reasonable person would consider to be a snack. In other words, they can't it can't be just enough little things that combined might be considered a meal. So it can get a little fuzzy sometimes, but the bottom line is it can't be a meal. Let's talk very quickly about licensure and appointment and termination of agents. This is very, very important. You want to make sure that whoever you're dealing with is, in fact, a licensed agent or broker in the state of Oklahoma. Each agent and broker is licensed within the state within which they are operating. And I learned something interesting this weekend. In some states, their licensure may be even broken down by the county that they're operating in. So the Medicare Advantage plans and the drug plan agents and brokers, they've got to comply with all the state licensure and appointment laws. So regardless of these Medicare Advantage plans, they are national. The drug plans are national. However, they have to be licensed within the state in which they are selling that product. Now, if an agent loses that license, if they get terminated from the plan that they are working with for whatever reason, that plan will notify the state that they have been terminated if the state does require them to do so. And Oklahoma is one of those states where that is required. All enrollments that are made by an unlicensed or terminated agent, that is also reported to the state as well as to the CMS account manager. So all agents and brokers must be licensed and appointed under state law. They must be trained and tested annually. Also, they have to pass with an 85% or higher before they can market any products. And they have to secure that document, that scope of appointment that we talked about prior to meeting with any potential enrollees. Pardon me. Now, regarding marketing and sales events, the contact information cannot be required to attend an event. In other words, they can't make you sign and give your contact information. The sign-in sheet must be labeled as optional. Any health screenings or health surveys or other activities that may be seen as or used to target a subset of the enrollee population is prohibited. In other words, they used to say, oh, we'll do a health screening or a free blood pressure check or something like that. Well, what they learned was people were kind of using that to screen out anyone that might be high risk or, more expensive client. So they can't do those anymore. They can use contact information provided for raffles and drawings, as I said earlier. So that's sort of an exception to the rule to try and entice people to sign that contact information form. So very quickly, because we're running out of time, I'm going to slide through this list of do's and don'ts as quickly as I can. So what they are not allowed to do, they cannot ask for information like your bank account information, your credit card information over the phone unless they need it to process the enrollment form. Unless you've said, yes, I want to enroll, they can't ask it. If they're trying to give you, if you're asking for a quote, if you just want to know how much it costs, they don't need to know anything about your bank account. They can't come to your home uninvited. Think vampire, all right? They can't show up. They can't call you unless you're already a member of the plan and that you've given them permission to give you a call. You've asked them to give you a call to tell you more about the plan because you're interested in possibly enrolling in it. They can't require you to speak to a sales agent just to get more information about the plan. They can't ask you for payment over the phone or online. The plan has to send you a bill. They can't call themselves a Medicare supplement plan. We've had lots of people that thought they were enrolling in a supplement when actually what they were getting in was a Medicare Advantage plan. They have to identify themselves accurately. They can't sell you another insurance product, such as a life insurance policy, during a sales pitch for a Medicare health or drug plan. They can't make an appointment to tell you about their plan unless you agree. That's that scope of appointment that we talked about. They can't talk to you about their product in an area where you're getting health care, such as a hospital room or an ER or an exam room. Can you imagine? Gosh. They can't market their plans or enroll you during an educational event, like at a health fair or a conference. They can't advertise to you without using a specific plan name. So often we see booths at places where they have done a very sneaky job, I'm sorry, but that's what it is, of making the sales look like they're a government agency or something like that, and they're not being, in my opinion, honest about what it is they're trying to sell. If you believe in your product, you should just be open and honest about what it is that you're providing, uh, and just call it what it is, and not trying to hide behind fake logos or American flags and eagles and things like that, or the Medicare logo and things of that nature. So if you're meeting with an agent, here's what they can do. They can give you plan materials. They can tell you about the plan options and how to get more plan information. They can give you an enrollment form, but they can't make you sign it and fill it out right then. They can, if you choose to complete the form, they can collect your completed enrollment form, and they can also leave you some business cards if you would like to give them out to some friends and family. What they can't do is they can't charge you a fee to process your enrollment form into that plan. They can't steer you into any particular plan. That's got to be your choice. They can't give you any incorrect information about their plan type or use things like ours is the best or it's the highest ranked or anything like that. They can't tell you about plan options you haven't agreed to discuss, things that we've already talked about, like life insurance plans and things of that nature. They can't pressure you to join plans by saying things like, if you don't join the plan right now, you're not going to have coverage for next year. They can't they can't ask you to give them names and phone numbers of your friends so that they can market to those people. That's a no-no. They can't ask you to sign the enrollment form before you're ready to join. You should only sign the form when you're ready to sign on the dotted line. If you're not sure, don't sign. So a few other key things that you want to remember. Don't enroll in a plan based solely on the supplemental benefits. Just because they've got dental or vision or hearing or some other benefit, like a fitness benefit for crying out loud, don't enroll in one of these plans. The primary focus of these plans is your health benefits. All right. And if you are looking at these plans because of some of these other benefits, be sure you're looking at what the scope of those benefits are. How much dental insurance is there? Some of these plans don't have a whole lot of coverage, and it doesn't take long for $2,000 worth of dental coverage to be gone. Do your own research, look for the reviews, talk to your doctors. Talk to the people that are actually delivering your healthcare now and get their opinions. See which plans that they currently work with. If you're going to a doctor now and you've got a health treatment plan in place, you want to make sure that you're not going to get enrolled in a plan that isn't contracted with your current doctor, because that could really disrupt your treatment. Talk to your friends, the friends that live in your area. Don't talk to a friend that lives in Sarasota, New York, because that's not going to work. What you want to do is you want to know what plans are working well in your area now, because that's what's going to be important. Give us a call at the Medicare Assistance Program. That's our phone number there. And we're going to give you free, unbiased advice. We're going to tell you what we know about the plans in this area. Now, we can't tell you which plans are best, which plans are worst, or anything like that. But we can help you identify what's important to you, what are the factors that you need to be thinking about, and help you arrive at the decision that's best for you. Now, I also wanted to remind everybody, we've got these healthcare journals. This is a great way for you to keep track of your contact information, the information you need to be sharing with your doctors, your appointments, the information that you need to be looking at when you're reviewing your Medicare summary notices and stuff. This is a great way to help fight fraud. These are free. Give us a call and we'd be happy to send you one. These are the partner agencies with whom we contract around the state. These people can provide the same counseling that we provide at our office in Oklahoma City. So if you live somewhere in Oklahoma City, please give these folks a call. They would be happy to help you. If you know someone that lives in one of these areas, maybe you can shoot them in that direction as well. Those are the counties they cover. And I know we're over time, but that was a lot of information. Wyatt, are there any questions that we need to look at?
Yeah, so we have two questions. First one is, could you please give us an example of probable fraud advantage plans? Fraudsters make it look good.
Well, one of the main ones that we're running into right now, and it's when we're talking about fraud, it's not just out and out fraud. We're seeing a lot of people who have been contacted by someone who represents an Advantage plan and is talking to them about the benefits of this plan. And somehow this person is getting enrolled mid-year in this Advantage plan when really they shouldn't be enrolled. They don't really qualify for a special enrollment period. And what we're learning is what that insurance agent has used is an SEP for a government declared natural disaster. Now, we've had some natural disasters in our state, unfortunately, but the issue is that that what that is for people who were directly impacted, for one, by that natural disaster. In other words, their home was hit, or someone that person relies on for advice was hit by that natural disaster. Secondly, that disaster occurred during an enrollment period that prevented that person from being able to take that action. Unfortunately, what happens is when that person, the agent, is doing the enrollment and they check that box, the system isn't being monitored closely enough and the enrollment goes through. And that's creating a lot of problems. And fortunately, when it gets reported to our office, we've been successful in getting that reversed. But that's an example of what I would call fraud that we've been dealing with on the Medicare Advantage side. What was the other one?
Please talk about how agents, brokers can only talk about the plans they are contracted with. The only way to see all plans is on Medicare.gov, right?
Well, what you're going to see with an agent, most of the time, brokers and agents are not going to be appointed. Appointed means this is a plan that they have a business relationship with. In other words, they are compensated to sell this plan. So they are going to have a vested interest in selling these particular products. So a broker or an agent isn't going to be interested in selling every plan that's out there. They're going to be really pushing the ones that they're going to get a commission for. So no, they're not going to be selling every plan that's out there. The ones that they're going to be selling are the ones that they have signed a contract with that particular carrier to sell their products. When I'm talking about not selling other products, I'm talking more about any other kind of insurance vehicle that they might be selling, like life insurance or an annuity or something of that nature. Not so much another Medicare Advantage product that they may not even be interested in. I hope that answered the question. Anything else?
Our last one, is it possible to get a copy of the presentation slides? So I will say that all of our Medicare Mondays are recorded and they're available at map.oid.ok.gov and on YouTube.
There we go. All right. I am so sorry that I kept you guys long today, but this is very important. Probably for the rest of this calendar year, our focus on the Medicare Mondays is going to be on topics related to open enrollment. We are, going to be focusing on what people need to be doing to prepare for and to make the right decisions, to make good decisions for open enrollment, what they need to do so that they can go into 2026 with the best coverage possible for themselves. So with that, I hope everybody has a good week and we look forward to seeing you next month. Thanks.